The patient with a history of the ear pain also can have a, hyperpharingeal malignancy, sir. If the patient has history of tobacco usage. Yeah, sir. This is the referred otology, sir. Referred ear pain. This on act, sir. Yes, sir. The patient was having the history of since 20 years, sir.
Little or more? Huh? We have to tell
Yes,
him
sir.
what amount is the huh? Because everybody is now taking. Suppose if taking once in a day, no problem. He is taking twice, thrice, or morning since morning to sleep. He is doing like that. People are there.
Yes, sir.
Uh, always doing.
Yes, sir. And your question as sir staging. In staging, there is a TNM staging. In T0, if the size of the tumor is less than 2 centimeters, uh, sir, this is actually T2, sir. T2 N0, sir. There were no lymph nodes, sir. The neck examination was probably normal, sir. Everything. There was no palpable nodes or neck fixity also not there, sir. Laryngeal crepitus was also present. And in CCT we have done in CCT also only there was no involvement of larynx, sir. It was also mentioned, sir. Only vocal cord in indirect laryngoscopy findings. We have got the left vocal cord diminished movement was there, sir. Palsy was noted, sir. That's it, sir. So for that we have already done the CECT and MRI, sir. To yes, no, sir. We have done the chest X-ray, sir. Actually, in hypopharyngeal carcinoma cases, the main primary metastasis can lead to reaching lungs only, sir. So to rule out that thing, we have done the chest X-ray, sir. No, sir, probably you can say like that, sir. Actually, patient came to our OPD with complaint of only ear, sir. And their ear findings were really totally normal, sir.
Excuse me. This presentation to the pain in the left ear is
Yes,
a
sir.
common symptom to everybody.
Yes, sir. Actually,
What is important take-home message here?
Yes, yes.
Nothing here.
the positive history, sir. The I see the
What is
patient was
positive?
in.
No, what you positive said is 20 years of tobacco chewing with left ear pain. That's all.
Yes, sir.
What else is there?
The thing is.
What is the take-home message in this?
Yes, sir.
No. What is occult carcinomas in the thing? What is occult carcinomas in the oral cavities? Where are all the hidden areas?
Pyriform fossa only the
Only one. Yes, surgery people.
retromolar trigon.
Tell me that.
Yes, sir. And tonsillar fossa.
Tell. That's 5, 6.
Sir. Base of the tongue.
Then what is that? It is no factor. When you cannot get it, we have to go for that. You got it, that lesion. It is a pyriform fossa. You got it. There's also a proliferative. So once you go there, it is OPD base. You can diagnose.
Yes, sir.
No, diagnose or not diagnose?
Yes, sir. We can diagnose, sir.
What is the thing?
The main thing is, sir, the patient was having ear pain, sir. So
Ear
we
pain,
have
then
done the auto.
what is
All
anatomy?
ear
What is
pains
anatomical
with
location?
tobacco chewing, you have
No,
to
sir,
give
it's a-
message like that. Don't
no, sir.
neglect.
Like that. Actually, if there is a elderly patient with ear pain, you should not neglect. You have to examine all the system, ENT,
endoscopy, yes,
ear,
sir.
nose, throat, and pan endoscopy. You have to do pan endoscopy.
That is the
If you
patient.
neglect a simple ear pain, then they will after some time they will be in metastasis.
No, that is not your take-home message.
That
You have
is-
presented the case, that's all.
Yes, sir.
Like a normal case.
Yes, sir.
What your discussions of comparisons, what is the publicity, what is the literature has given, what you have diagnosed, what you have found out other than this different from that, that is important. Not just your case presentation is there, you are routinely we are doing, routinely we have come up.
Sir, in literature.
So that is not the one. What you have published, what is my publication, how we got it, what is his percentage, what is the rarest.
Yes, sir.
That is the take-home message which you are not given.
Sir,
One. Second thing, how many biopsies you supposed to take?
single confirmative
Single.
biopsy is more than enough, sir. Along with if the nodes are involved.
It's a growth. How
Yes,
many you have
sir.
taken? Biopsies. How many biopsies?
We can perform.
You have taken only one.
Yes, sir. Dual scope biopsy was performed, sir, and 3 to 4 bites were taken, sir. It's also mentioned in the.
Which site will take it? Which site will take it? There is also a palfret growth is there. And you said how many? How many you have
3 to
taken?
4 bites were taken, sir.
Where
I
all
was-
you are supposed to take? There you're going to miss it. Where you're going to miss it? Definitely going to miss it if you don't take 5. Why? What is the reason behind taking 5? What is the reason? I'll take 1. Yes, there is a growth. I'll take 1. Why you have mentioned 5? And what depth you have to go? What depth you have to go? I'll take 1 and come back. It comes as a negative. Or you will give, pathologist will give either it this way, nothing, not inconclusive. Then again, do you think you want to leave it now? Then why that 5 has come? What depth you have to take it? And how you have to preserve those things. Is it not? That is important. You have to read those things also. Okay. Then you said, after confirmed histopathology, main important, going for staging. Why do you
Yes,
want staging?
For management and treatment modality, staging is important, sir.
What is that management will differs?
Sorry,
What is your stage in this case?
this is stage T2, sir.
T2.
T2, yes, sir.
N0 not there.
No, sir. N0, sir.
Then T2 because of this. How do you measure it? It is not, we cannot buy, only we see, we cannot put a scale there. Now you only, your visual things you are doing it. How do you measure it? That is very important, very sensitive. Very, very, very big surgeries will be going it. Very big surgeries.
Okay.
A destructive surgery. It is not constructive. It is a destructive surgery. You should, what is the real CT scan? How do you read CT scan or MRI? Which is important now?
Sir.
You going to offer MRI or CT for staging?
Yes, sir.
There is also glottis, you can see there is a edema and everything. And there is a construction goes, voice also goes off. Then what is the purpose of doing a surgery for? So how do you assess whether you want to order MRI or you want to order CT? Which one you want to order in this case now?
So MRI and CT both has their own
TNM staging. Why? Because in this case, very important. Clinically, it is clear. What is that you got it? Clinically, no lymph nodes.
yes, sir.
Adjacent structures, we cannot estimate it. Only by MRI.
Sir, laryngeal framework involvement can be identified through CT only, no, sir. Bony involvement.
That's why,
of the
no.
fixicity.
First is extension.
Yes, sir.
Extension important because your surgery makes a lot of difference. Once your surgery goes wrong, patient voice gone permanently. Is gone. What is the use now? What is the quality? Very important. Both has to be combined. How to read? Go through that. And you have to sit with a radiologist because you are the operating surgeon. Don't depend on radiologist. They are only trained with images. You have to sit with the radiologist. You have to accurately mark where exactly your scalpel makes the difference. Very, very important, sensitive. Okay. Very important. And another one, you are given only presentation. You have to add up those things, not this. No, in the world-wise, this is the thing, has got this in this case, they have did this. We also did this case and we also got this. That is, we have to give it. CME, you have done this case. What the world people literature has done for this case and what we have done, whether it is equivalent or not equivalent or we are worst. Something you have to say. Or we almost try to some baselines. That is important, not price case presentations. Okay?
Okay.
Thank you very much.
Thanks.
Next presentation is from Department of Community Medicine.
Good afternoon. My name is Dr. Puneet. My moderators are Dr. Josna Kiran and Dr. Varsha ma'am. My topic is about One Health. So One Health, it recognizes that human health, environmental health, and animal health could not be discussed in an isolation way. The approach is collaborative, multisectoral, and transdisciplinary. Okay. So it's all started when Robert and Koch has studied the link between humans, microbes and animals, where in 1960 the shift has been occurred, where focuses on food safety and zoonotic disease prevention. In 2004, uh, we had an official one formal adaptation of One Health, where it gives an unified approach to One Health. In 2010, tripartite collaboration happened, and 2022 latest, the global health scrutiny and national One Health mission has been reinforced, where we learn from COVID-19 pandemic and antibiotic resistant for pandemic prevention and pandemic preparedness, where we studied these are the main issues we are studying in the One Health. The rationale is the global burden of infectious disease has been huge, where 60% are zoonotic diseases. In that 60%, 70% are coming from the wildlife, giving us the annual death burden of 2.7 and 2.7 million deaths annually, and a economic burden of $6 billion US. In addition, we have a climate impact also, where conditions like environmental degradation, deforestation, and rise of temperature has been alter the conditions for vector distribution. So this is antibiotic resistant. We all know this is a silent pandemic ongoing, where recent stats says that 40% has been increased in the resistance of antibiotics, and 2023 stats 1.27 million deaths happened globally, with 5 million deaths associated with the antibiotic resistance. And what are the solutions for this? We need to provide proper antibiotic stewardship, and medical surveillance need to added. If you see, this is the these are the when 84% are already resistant infections, where 16% are the susceptible infections. The diseases like COVID-19, Nipah, avian, and Ebola, they are creating a huge impact, which are all these are from likely from animal sources, and deaths has been high mortality has been happening. So quadripartite collaboration, coming to this, World Health Organization in 2010, actually, the Food Agricultural Organization and the World Organization for Animal Health and the UN Environmental Program, they formed a tripartite collaboration, in which in 2013 World Health Organization joined them. In 2022, we adopted the same, India reinforced in 2022, we adopted the same One Health mission, with the key objectives of 100 zoonotic sentinel sites to be established by 2027 to integrate human, animal, and environmental health, to strengthen pandemic preparedness and capacity. And what are the progress as of now? Out of 100, there are already 77 sentinel sites has been established, with the framework components of interministerial coordination. The main National Institute of One Health has been established in Nagpur, with the state level implementation partnership. So the National One Health Mission has been under Prime Minister Science Technology Innovation Advisory Council. A total of 13 ministries has been collaborated with a lot of NGOs and private partnerships. Together all aiming on pandemic preparedness, joint outbreak response, integrated disease surveillance and strengthen routine prevention programs. Core component of National One Health Mission, the laboratory work networking. We are focusing on biological safety labs, level 3 labs, with quality assurance and integrated surveillance of all the human, animal, and environmental. With the capacity building, we're focusing on the capacity building. We are training a number of um, we're training we're training at rural level where the people are main. So national institutional structure, the interministerial coordination, national institution, there is interministerial coordination should be happen. They provided the framework with the technological working groups. They will provide the expert guidance. With the state implementation, all the other states will follow the national policies. So this is a success story. This is the success story where one of our favorite states has been eliminated the rabies in 2000. Even before the National One Health Mission has been came into existence in India, in 2013 itself, they provided the they did the work by giving 4 lakhs rabies vaccine doses to the dogs. In 2018, there is no active cases, and the state has been declared rabies free by 2023, which has been the streak has been broken in 2024, where 1 rabies case has been found. This SWOT analysis. The One Health, we have integration and global alignment, where our institutions, our PM framework has been with the in talks with international institutes like FAO, UNEP. Our weaknesses, there is a fragmented intersectoral coordination, limited laboratory integration has been there. Opportunities, we have, yes, AI-based surveillance tools. This is one of our opportunities now. Integrated with National Digital Mission. These things are associated with the PMABM and National Health Missions. Threats, yes, there is a climate change. Deforestation has been one of our threat. Political and bureaucratic inertia, it will disable the if they are not providing proper funds, it will create an impact. Risk of donor dependency. These are my references. Thank you.
What is that? Dog menace, you tell rabies vaccination.
Rabies,
Is rabies vaccination is the only criteria for elimination of rabies, or other things? Any other states are thinking of? Some states we read, they're doing surgeries for the dogs. You have not mentioned that.
oh, yeah, okay, sir.
In
Okay.
certain places, lot of
Sir.
birds are there. A colony of birds are there causing the respiratory diseases.
Sir.
The pigeons and other things
Sir.
causing. So, what for the health of this? What advice you want to give for the society? Because another thing is in
Sir.
Delta districts, they are growing this culturing fish. And this water is polluted, drinking water is polluted, and they are getting diseases, gastrointestinal diseases. But what are the recommendations we have to give to the public? There are all these some of the things,
Oh, okay, sir.
environmental problems,
Sir.
apart from other problems. Okay.
Okay, sir.
Hmm.
I will see about this.
What is the time period left for the disease free?
Sir.
What is the time
period-
duration?
Time duration for, sir?
Time duration for disease free. You said 3
Sir,
years.
we have keeping the goals and aims for 2030, sir, for National One Health Mission.
No, you didn't get me my point.
Sir.
The Goa is announced.
Ha, sir.
Uh,
The state has been announced as rabies free by 2023, sir.
23.
23.
They did not recognize any of the within 3 years.
As of now, I mean, by then there is no National Health Mission, sir.
Hmm.
yeah,
But
active.
immunization was, what was the percent of immunization for a dogs they have done it?
Sir, I have seen the official website. They have saying that about more than 90% of dogs are vaccinated.
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 So new dogs will be produced, you know.
Yes, sir.
Ah.
But we,
No, any dog bites are reported.
huh?
How many dog bites are reported? Comparisons. Dog bites reported and incidence of rabies after vaccinations.
So the
Anything
streak,
in the study is there?
the streak has been broken in 2024, sir, where one active rabies case was found. The dog bites I saw for Andhra Pradesh, sir, where we have more than 1.5 lakh dog bites. And for the latest last year stats, we are standing in third position in entire India, where 39 active rabies deaths happened in.
No, what
in
is the percentage now incidence of a dog bite getting to rabies? What is the percentage of incidences of rabies in spite of the dog bites? You gave 1.27 lakhs you gave, no? Bites. So what was the
How many
percentage
dog-
got it in that? How
how
many
many-
cases have been reported?
Reported
Rabies.
cases.
Reported dog bites, sir.
No, reported by 1.27 you told.
1.2,
Divided
sir.
by
Ah.
percentage.
Ah.
Great.
What is the incidences of rabies among these bites?
Total cases, incidence is new cases, no, sir.
Yeah,
Ah.
that's what I'm asking. Incidence means new case only.
Percentage,
No,
I'll
you don't.
calculate,
Okay,
sir.
that is important.
sir.
What is risk?
So 1.25 divided by 39, sir. No.
You calculate
Yes, sir.
No, no.
I mean, I will calculate, sir. This is
No, that's
mathematics.
not the calculation. There is already percentage has been
Yes, sir.
given.
I will look after
There
that.
is a percentage has
Yes.
been already given, the incidences.
Yes, sir.
My question is that
Sir.
all the dog bites may not have a rabies.
Yes, sir.
Who gets the rabies now? If we gets the rabies, what was the culprit in that virus? Do you think it's a normal the rabies vaccine, rabies virus? It is already there in the dogs.
Yes, sir.
Then
Ah.
how it will become active?
Okay.
No,
sir.
inhabitants that. That is very important there. All may not get it.
Sir.
Huh? And there is no preventive vaccination for human. It's only post prophylaxis.
Yes.
You are giving only post prophylaxis.
Dogs.
That means we don't know really what is that virus, how it is. Still, it is a problem for us. That is the thing we are not able to get it.
Okay, sir.
Vaccination, prophylactic vaccination. Only post exposure we are getting it.
Yes.
Okay. So what is the take home message with this?
Take home message is, sir, if we give prevention, if we give preventive measures to the animals and environmental, we may get, we will get safety, sir.
What are the preventive measures?
Those preventive measures, sir.
We are telling only rabies vaccine after a bite.
Sir.
So all the pet animals should be vaccinated first, second.
Yes, sir.
Third, what about that? What about these birds?
There are national for
Mm.
birds. Is there any?
You are give so many
Any
avian,
vaccination is there?
Napa virus,
Can
so
I-
many
What-
things you have made up.
Vaccinations
Can I
are there,
take-
you know.
can I take
Influenza
help of,
virus
kids?
vaccine and other things are there.
Everywhere there is a pigeons all there.
Sir. Mankind? Environment. Yes, sir. Yes, sir.
Not one.
By
particular-
protecting one, we may protect others, sir. We are, by protecting one, we are protecting others.
Go through once again. Huh?
Sir,
Okay.
thank you, sir. Yes, sir. Yeah, sure, sir.
You are trying to do your best, I agree, but still it is not sufficient when you want to present it in the public, right?
Sure. Sir, thank you.
Now time for the faculty presentation by Dr. Ravi.
Okay. So good afternoon, everyone. I am Dr. Ravi Kumar, Associate Professor, Department Anatomy. Online ఉంది సార్. ఓకే. సార్ వస్తా. ఓకే సార్. సో మై topic is the Syromelia case report, a rare case, abnormal deformity, and then it is identified in the Ashram Medical College. Okay, and then I do the work in the Ashram Medical College only. So introduction, definition: Syromelia is a condition where the partial or complete fusion of the lower limb. In this condition, it is known as the mermaid. Actually, that lower limb buds, these two are fuses partially or completely, and then surgically we can separate, but the what is that one? Living ratio is very less. And then there is a vectoral anomalies are present, that vertebral anomalies, anal atresia, cardiac defects, thoracoesophageal fistula, esophageal atresia, renal anomalies, limb defects. These are all known as the vectoral anomalies. And then incidence is the 1 to 4 in 1 lakh births. That is, the male is more in the, and then females are 3:1 ratio. It shows a severe malformations of the gastrointestinal and then genitourinary, cardiovascular, and musculoskeletal system. However, oligohydramnios secondary to the severe renal dysplasia is universal. And then Syromelia or mermaid syndrome was initially stated by the Roches in the 1542 and the Pelfia in the 1553, and the name was given after the mythical Greek Serene. So you can classify the Syromelia into the 7 varieties. Okay, all the thigh bones and leg bones are present, but the soft tissue was fuses. But all the leg bones and the thigh bones, the tibia and the fibula and the femur, all the present. But the soft tissue is fuses with, and then single fibula is present, and then remaining bones. The absence of fibula, partially fused femur, fused fibulae, and then partially fused femur, single femur, and then single fibula, and then single femur, absent of tibia and fibula. And then my case is the 6th variety, single femur, absent of the tibia and the fibulae. Sorry, 6th one, that is the single femur, and then single tibia is present in this one. So here we can the picture, the type 1. This one is the type 1. 2 tibia are present, and then tibia, femurs are present, tibia and the fibulas are present, but the soft tissue is fuses here. Both limbs are fuses. And then the second one is the tibia, 2 femurs are present, and then fused fibula is there here, then 2 tibia. So here because the fibulas are fuses with each other. And then in this case, in the third one is the fibulas are absent, but the soft tissue is fuses with each other. In the fourth one, here we can see the upper ends of the femur are fuses with each other, and then lower ends are remain intact, and then 2 tibia, and then here we can see the fibula is fuses with each other. And then in this 5th variety, upper end of the femur, the partial fusion of the femur, and then there is no fibula, only the 2 tibia is there. And then 6th one is the femur and the tibia is there. This is the my case report. And then in some cases only the femur is present, both the tibia and the fibula both are absent. So I am presenting this case. So a case of intrauterine death. Features of the Syromelia was studied. The baby was born to consanguineous parents at 34 weeks of gestation, having the birth weight 2.8 kgs. There was no history of exposure of teratogenic agent during the antenatal period, and mother was non-diabetic and then non-hypertensive. This is the case. And then external features of the baby, the normal appearance above the level of the umbilicus, and then there is abnormalities below the level of the umbilicus only. All the abnormalities were seen below the umbilicus, and then umbilical cord was short, and then single umbilical artery. Actually, there is 2 umbilical arteries are there, and then in this case only we can see the single umbilical artery. There was a single fused lower tapering extremity was with the absence of the external genitalia. There was a meningocele at sacral region. Anal orifice was absent. This is the picture. And then here we can see this one is the umbilical cord. Below the umbilical cord, the lower extremity was fused, and then above this one, all the features are normal. Head and neck is present, and then upper limbs, and then thorax and the abdominal cavity, all this normal. And then below this one, the lower limbs are fuses. And then there is no anal orifice here. There is no genital organs also present in this case. So embryologically, it is a severe developmental field defect of the posterior axial caudal blastoma. It occurs in the primitive streak stage during the third week of the gestation before the development of allantois, and the allantoic vessels usually absent. So my aim, the external and internal features of the case of cyanomelia was studied. So materials and method, a case of intrauterine death presenting the features of the cyanomelia was studied. And then observations, the external features, in this case cyanomelia, okay, showed as a normal appearance above the level of the umbilicus. And then below this one, the lower limbs are fused. And then all abnormalities were seen above the umbilicus. Umbilical cord was short, and then a single umbilical artery is present. Observations, there was a single fused lower tapering extremity, and then absence of external genitalia. There is no external genitalia present here. Okay. And then anal orifice was absent. There is no anal orifice, and there was a meningocele at the sacral region. This here you can see the meningocele present at the sacral region. And then autopsy findings, heart, lungs, esophagus were normal. Pericardial sac was large. And then GAT ends blindly. So here we get the GAT ends blindly at the level of the transverse colon. So at the level of the transverse colon, GAT, the gut tube is blindly ended. And then suprarenal was large in size. Kidneys were hypoplastic. And then ureter ended in the solid mass of the tissue, which could not be differentiated into the particular structure. Here we can see the ureters ended. And then X-ray findings, the single femur is present. Sacral bones are not developed here. And then the pelvic bones doesn't develop properly. And then only one femur and then one tibia is there here. And then histological findings. This one is a normal 2 umbilical arteries and then 1 umbilical vein is there. In this one, only 1 umbilical artery and then single umbilical vein is present. And then in the villi were hypoplastic with a lot of fibrous tissue is deposited in the villi. And then in placenta, infracted and hemorrhagic areas were seen. Here we can see. And the large fetal cortex of suprarenal gland. And then hypoplastic kidney was observed. Nephrons are not developed properly. And then undifferentiated gonadal tissue was seen. Here we can see the gonadal tissue is not developed. Undifferentiated gonadal tissue. These are the histological findings. And then discussion, mother of a dead-born baby being a primate, she was not aware taking of any drugs, exposure to the eclipse, etc. No history of consanguineous marriages. Mother is not a diabetic. History does not throw any light on this case. Okay, risk factors. Different kinds of the theories have been suggested, such as a maternal diabetic. However, in this case, mother was not known as to be diabetic. And the genetic and the environmental factors also plays a role. Hyperlink pointed out that the teratogenic agents like cadmium and elements like lead, and then it results also cyanomelia. Some studies showed that there is a potential teratogenic effects of the vitamin A, cocaine, and irradiation exposure. Ethiopia-chogenesis, an embryological insult. The sequence of events resulting in the cyanomelia starts from a embryological insult involving the caudal mesodermal, begins between the 28 to 32 days of fetal life. By this time, the cloaca is already formed and the kidneys are found in the pelvis, while the gonads are intra-abdominal. Hence, any developmental abnormalities of the caudal extremity affect equally the kidneys, bladder, and the terminal bowels, the pelvic bones, are as well as the genitalia. In this sequence, there is a renal agenesis, absent genital organs, anal imperforation, absent rectum, and then dysgenesis, agenesis of the sacrum, the vascular steel syndrome. This is the another theory. Stevenson proposed this vascular steel theory. This explains the developmental abnormalities on the caudal extremity. It suggests that the shunting of blood via an abnormal abdominal artery which arises from the higher up in the aorta towards the placenta. This results hypoplasia of the vasculature distal to the artery, leading to the nutritional deficiency of the caudal half of the body. So in this picture, this one is the normal one. The two umbilical arteries arises from the two common iliac arteries. But in this case, there is a higher origin of the umbilical artery, the superior origin of the umbilical artery, single artery, and then the arteries. So here we get the placenta is there, and then caudal to this one, the arteries are atrophies because this single higher origin of the umbilical artery took the blood, and then these arteries are atrophies. So the lower extremity is not developed properly. So in this case, the lower single umbilical artery is present in the histological finding, and then the lower extremities are not developed. So the vascular steel syndrome. Okay. The caudal extremity described above, but the gonads are spared at this area, intra-abdominal. The single umbilical artery in this case favors this theory. So gonads are spared because it is intra-abdominal, and then external force acting the caudal extremity. This theory suggests that the external forces acting on the caudal extremity of the embryo causes its hypoplasia. This theory was supported by the Gardner, who suggested that excessive rotation of the neural tube at its caudal end provoked a lateral rotation of the mesoderm, causing the fusion of lower limbs and closure of the primitive bowel and the urethra. As a part of the vectoral, another theory described cernomelia as a part of the vectoral syndrome. There is a major overlap in the phenotypic manifestations of cernomelia and vectoral. In most cases, distinction between the cernomelia sequence and the vectoral is based on the severity of the component defects. And then a case of cernomelia with a single lower limb can be regarded as an indicator of other severe malformations. In this case, autopsy reports tell that a part of vectoral, here we can see the presence of anal atresia, and then renal anomalies, and then limb abnormalities. And then genetically, in animal models, several genes have been found to cause or to be associated with the cernomelia. The serine SRN gene is observed to cause the hindbud fusion in the homozygous mice. So these are the genes. TSG1 and then BMP7 will also have the hind limb fusion. And then this is my conclusion. All cases have been sporadic. More recent theories suggested the vascular pathogenesis resulting from a vitelline atrial steel, and then resulting in the diversion of blood flow from the caudal structures. And then these are the cernomelia survivors, the three survivors, Stephanie York, and then Melagros, Serene, and then Cello. These are the three survivals. These are my references. Okay. Thank you.
Department of Dermatology and Department of Anesthesia. Where the patients will be informed later.
In this case, there's a lack of things, some literatures in this. All been blamed some environmental factors, which is less likely because